Good morning, dear fellow Toastmaster. Today I'll be talking about myocardial infarction. What is myocardial infarction? Let's go one by one. So for today's agenda, we'll talk about myocardial infarction, its symptoms, causes, risk factors, complications, diagnosis, treatment, and followed by summary. What is myocardial infarction? A myocardial infarction is a medical term for heart attack. Occurs when the blood flow to the heart is reduced or blocked. A blockage happens when fatty deposits build up in the walls of the arteries supplying blood to the heart, resulting in a poor oxygen supply to the heart muscles. If the blood flow is not restored promptly, the affected heart tissues dies. Some patients experience chest pains when a heart attack occurs, but others present no symptoms at all. It is crucial to recognize the warning signs of a heart attack because it can largely be prevented. Myocardial infarction is the number 2 leading cause of death in Singapore or worldwide after cancer and is the leading cause of death in some parts of the world. So now, what are the symptoms? The symptoms of the myocardial infarctions, common warning signs of a heart attack include chills or cold sweat, chest discomfort or pain that feels like pressure or squeezing or clenching or fullness, feeling dizzy or lightheaded, nausea or vomiting, pain or discomfort in the chest or upper body that may spread to the jaw or the arms, prolonged and severe central chest pain, heavy and crushing sensation, shortness of breath, which may occur on its own or with chest pain. While chest discomfort or pain is the most common symptoms, women are more likely to experience shortness of breath, nausea, vomiting, and back or jaw pain. Now, what are the causes? What causes myocardial infarction? The most common cause of heart attack is the narrowing of one or more of the arteries that supply blood to the heart. This results from the buildup of cholesterol deposit in the walls of arteries, a process known as atherosclerosis. This restricts blood flow to the heart muscles and compromises the supply of oxygen. A partial or complete blockage of the heart arteries may then arise, and a sudden and severe blockage can lead to a heart attack. What are the risk factors? The risk factor for myocardial infarctions, there are modifiable and non-modifiable risk factors associated with a heart attack. Modifiable risk factor includes cigarette smoking, obesity, chronic conditions like high blood pressure, diabetes, and non-modifiable risk factors include age, strong family history of disease, ethnicity, gender, and menopause. So what are the complications? The complications and the related disease of the myocardial infarctions are heart attack, serious event with long-lasting consequences and complications. Potential complications from a heart attack can vary widely from mild to life-threatening. These complications includes arrhythmia. Arrhythmia occurs when an abnormal heart beats either too fast, too slow, or irregularly. This affects the flow of blood and oxygen to the heart and can lead to palpitations, chest pain, dizziness, fatigue, or breathlessness. Heart failure. Heart failure happens when the heart is unable to pump blood effectively to the rest of the body. It can lead to breathlessness, fatigue, and build up a fluid in terms of the legs, odemia. Heart ruptures or cardiac ruptures. Heart ruptures or cardiac ruptures is a rare complications following a heart attack where the damage or trauma caused by a prior heart attack was created weakened area that can lead to tear or rupture. Cardiogenic shock. Cardiogenic shock is similar to a heart failure, not in a more severe form. Symptoms can include mental confusion, cold hands and feet, rapid heartbeats, pale skin, and difficulty breathing. The diagnosis. How is the myocardial infarction diagnosed? A heart attack can be diagnosed using a variety of tests which can be non-invasive or invasive. Sometimes a combination of tests may be needed. Non-invasive tests to diagnose a heart attack include electrocardiogram. An electrocardiogram or ECG records the heart electrical activity to help determine if a heart attack has already occurred. Chest X-ray. A chest X-ray helps to capture images of the heart, lungs and chest structure to reveal if the heart is enlarged or if the heart is accumulating fluid as a result of a heart attack. Echocardiogram. An echocardiogram uses high-frequency sound waves or ultrasounds to produce image of the heart-sized structure and movement to identify abnormal rhythm or the arrhythmia. Invasive tests to diagnose a heart attack includes blood test. Blood test checks for the cardiac enzymes, C-reaction protein, CRP, and other indicators to confirm if a heart attack has occurred, the extent of the damage, and determine the future risk of coronary artery disease. Cardiac catheterizations and the angiogram. In this procedure, a catheter is inserted and guided to the heart in order to inject a dye that makes the blood vessels visible on X-ray. This gives doctor a clear view on narrowed or blocked coronary arteries. Cardiac catheterizations can also be used to perform a percutaneous coronary intervention (PCI) to open blocked segments of a coronary arteries. If you are diagnosed to be at risk of the heart disease, your cardiologist will assess the severity of your condition and may prescribe medicines or the lifestyle changes. In life-threatening causes, surgical intervention may be required. Talk to your cardiologist to find out more. Treatment. How is the myocardial infarction treated? The aim of the myocardial infarction treatment is to unblock the affected artery quickly to minimize the damage of the heart muscles. Your doctor will evaluate the severity of your condition and perform the most effective way to unblock the artery. This may include a combination of surgery, medication, and the rehabilitation. Surgery to treat a heart attack. Surgical options depending on the extent of the blockage and the patient's health includes coronary angioplasty, where a small balloon or a stent, small mesh tube is inserted into the blocked artery to help reopen it and restore blood flow. Coronary artery bypass, in which a healthy blood vessels taken from a leg, arm or the chest is used to go around a blockage artery. This provides an alternative route of the blood flow to the heart muscles. Medication to treat a heart attacks. Medication is prescribed to help relieve symptoms such as chest pain and to reduce the risk of another heart attack. Medications may be necessary to help manage chronic conditions such as diabetes, high blood pressure, and high cholesterol, which increases the risk for another heart attack. Some medications your doctor might prescribe includes antiplatelet agents to prevent the formation of the blood clot, angiotensin II receptor blocker to help control blood pressure, beta blockers to lower blood pressure by making the heart beats more slowly, and with the less force. Calcium channels blocker to relax blood vessels. Diuretics to eliminate excess fluids and relieve strain on the heart. Statin to reduce blood cholesterol levels or the alternative cholesterol lowering medications if statins are effective or not tolerated. Vasodilator to relax the blood vessels and increase supply of the blood and the oxygen to the heart. The treatment cardiac rehabilitation is a program specifically created to improve your cardiovascular health affects a heart attack. A comprehensive rehabilitation program will encompass three aspects: exercise to help reduce weight and manage modifiable risk factors such as diabetes, high cholesterol, and high blood pressure; education, the improving your diet and managing your medication; counseling to quit smoking and the manage stress and anxiety and depression. Thank you. The summary: exercise-based cardiovascular rehabilitation program may reduce cardiovascular mortality and the myocardial infarctions. Thank you for listening and have a nice day.